Have you ever noticed that the area down there seems a bit darker compared to the rest of your body? Well, I'm Dr. Rena, a urologist and pelvic surgeon, and today I'm going to explain exactly why the genital area tends to be darker than other parts of your skin. If you're new here, I share urology-related content every week on Mondays and Fridays, covering topics like sexual health, bladder health, and much more. If you find this helpful, be sure to subscribe and share the channel with your friends. To begin with, it's important to understand that having darker skin in the genital area is completely normal. In fact, it happens to everyone. This change usually occurs slowly over time and often becomes more noticeable as we age. However, if you ever see a sudden or dramatic change in color, it's important to consult your doctor right away. Now, getting straight to the point, there are two primary reasons why the skin in the genital area appears darker than the rest of the body. The first reason is hormones. Your skin contains special cells called melanocytes, which are responsible for producing the pigment that gives color to your skin, eyes, and hair. In the genital region, the skin is more responsive to certain hormones, especially estrogen in women and testosterone in men. These hormones influence the activity of melanocytes, which in turn produce melanin, the pigment responsible for darker coloration. As people go through puberty, get older, or in the case of women, experience pregnancy, they may notice this area becoming darker. It's important to understand that this is a normal response of the body, and the skin typically does not return to its previous lighter shade after these changes occur. The second reason is friction. Regular friction in this area can stimulate melanocytes to become more active, leading to increased melanin production and darker skin. Activities such as shaving, using hair removal products, sexual activity, and even everyday rubbing from clothing can all contribute to this effect, known as hyperpigmentation. Once again, this is a completely natural process. If you're comparing yourself to images you've seen in pornography or elsewhere, keep in mind that those visuals are often edited or altered and do not reflect normal, natural appearances. If you prefer to reduce the chances of darkening in this area, you can try to minimize friction by wearing loose-fitting clothing. Keeping the skin moisturized can also help. Just be sure to apply moisturizer only to the external skin. For women, avoid applying lotions inside the vagina, as that area does not require it. If dryness is an issue, you can consider using vaginal moisturizers specifically designed for that purpose, or look into treatments like vaginal estrogen, which may also help with symptoms like dryness or recurring urinary tract infections. It's also helpful to avoid hair removal methods like waxing or shaving if they cause irritation, and to wear breathable clothing that helps keep the area dry by reducing sweat buildup. As mentioned earlier, if you notice any sudden changes in skin color, you should see your doctor. Skin changes can sometimes signal underlying conditions. For example, if the skin appears thick, velvety, or slightly rough, it could be associated with conditions like diabetes. If there's itching, it might indicate an allergic reaction to a product or even your laundry detergent. And if you notice bumps or spots, it's important to rule out possible sexually transmitted infections. The bottom line is that gradual darkening of the genital skin is completely normal, so there's no need to be concerned. And as always, take good care of yourself, because you truly deserve it.